Hello, this is Kim Jong-il. We are going to cover the topic bracket positioning for U44, L55 extraction. The premolar extraction can be divided into several cases. It's divided into U44, L44 extraction, and U44, L55 extraction, and the U44 extraction and U55, L55 extraction. The upper first premolar and the lower second premolar extraction cases are many among cases. Today, we are going to cover bracket positioning in this case. Especially for the lower second premolar extraction case, there is a high possibility for the extraction space to be closed, like in the picture above. This case is not good. If possible, it should be closed as the roots are parallel to each other. However, there would be some problems after extraction of the upper first premolar and lower second premolar. The problem at that time would be the unparalleled relationship between the root of lower first premolar and the root of the first molar, and root positioning with the upper lateral incisors. I recommend that you should focus on these two problems. In the first case, brackets should be selected first. First one is a bracket for the upper central incisors. There are many brackets, but in the premolar extraction cases in Mio, SWA bracket is used on the upper central incisors. Roth-type brackets are commonly recommended. However, MBT type is also okay. Basically, SWA bracket should be used between upper tooth number 1 and 2 in the premolar extraction case. Because when the extraction space is closed, it is likely for the upper anterior teeth to be lingually inclined. There are dots in the SWA bracket. Marks should be made correctly with dots. Dots should be placed on distogingival position. Dots are placed on distogingival position. Angulation and torque are already given. So, place it where you want to put by using tweezers. Basically, evaluation is made by bracket positioning gauge. First, determine the approximate tooth position by bracket positioning gauge. Then, it is preferable to be attached to FACC facial axis of the clinical crown when it's attached. If it is missed when using the bracket positioning gauge, the height itself would change. The items to be checked in the maxillary central incisors are as follows. First is the vertical height. The default vertical height is 5.0 millimeters. However, the actual height may vary slightly depending on the case. You will have to evaluate how to do it front to back and how much slot angulation is going to be. The SWA bracket is attached in the upper lateral incisors in the premolar extraction cases. Therefore, the Roth type with 9 degrees of angulation and 8 degrees of torque is recommended. Likewise, the dots will be placed on the distogingival side. At this time, be careful to attach the bracket correctly to the upper lateral incisors. In particular, in the upper premolar extraction, the tip affects when torque is applied by the wagon wheel effect. In the case of lateral incisors, the tip is an inclination of the mesial side of the root or the distal side. So, when torque is applied, the root of the upper lateral incisors are more likely to gather toward the mesial side. It is one of the main problems that can occur when the upper first premolar is extracted. If attach the bracket to the accurate position like this, what would happen? The roots of the upper lateral incisors are gathered toward the center. So you can see that the roots of the canine, central incisors, and lateral incisors are not parallel. In the upper first premolar extraction cases, how to attach? It should be attached so that the mesial side is positioned slightly toward the incisors. Give angulation to the proper bracket positioning and rotate the bracket about 5 degrees. What would happen if you rotate about 5 degrees? Later, when alignment is over, the root of the upper lateral incisors can be placed in place. It should always be remembered that FACC should be checked first and then the bracket is placed there. And then the mesial side is placed slightly toward the incisors. So the vertical height of the maxillary central incisors was 5.0 millimeters. The vertical height of the upper lateral incisors should be 0.5 millimeters shorter than this, 4.5 millimeters. And then angulation is better to position the mesial side about 5 degrees toward the incisors. Next is the upper canine. For the upper canine, a torque with 0 degree is recommended in mio-orthodontic treatment. Related to this, I will lecture on the bracket system again later. The vertical height of the upper canine is 5.0 millimeters, which is the same level as the upper central incisors. And since the extraction space needs to be closed, an inclination of -5 degrees should be applied. For the upper second premolar, 0 degree of angulation and 0 degree of torque are recommended in mio. For the upper premolar, the vertical height is 4.5 millimeters, and it is better to position the extracted part itself slightly toward the gingival side. For the upper first molar, it is recommended to use a convertible bracket at first. In the case of this convertible bracket, the -5 degrees of angulation is applied differently from other SWA devices in mio. What does -5 degrees mean? It means that the molar, mesially inclined, can be uprighted. 0 of torque was given. It is better to place the hook on the mesiogingival side. Again, remember that when the appliances are attached to the upper first molar, you must place it on the FA point of the clinical crown, that is, buccal grove. It is better to set the accurate position referring to the bracket positioning gauge. When using this bracket positioning gauge, you must measure parallel to the occlusal plane. In mio, the upper second molar also has -5 degrees of angulation. For the upper molar, the vertical height of the upper first molar should be 3.5 millimeters. And the height of the upper second molar should be attached at a height of 2.5 millimeters. It is recommended to attach appliances to the upper second molar later in the initial treatment period. Next, let's look at the bracket in the lower incisors. For lower incisors, brackets with 0 degree of angulation and 0 degree of torque are recommended in mio. As for the upper lateral incisors, 4 brackets will be placed at the same level for the lower central incisors and the lateral incisors. The vertical height is 4.5 millimeters for all 4 teeth. For the lower canine, a bracket with 0 degree of angulation and 0 degree of torque is recommended. When you look at the FACC line on the upper canine, you would find out the exact FA point. The vertical height of the lower canine is 5.0 millimeters, which is 0.5 millimeter deeper than the lower central and lateral incisors. For the lower first premolar, a bracket with 0 degree of torque and 0 degree of angulation is recommended. At this time, if you see the shape of the premolar, it is better to attach the concave shape in the same direction as the shape of the gingiva, according to the shape of the gingiva in the bracket. At this time, marginal ridge discrepancies are likely to occur in between upper first molar and second premolar, as well as in between the lower first molar and second premolar, or the lower first molar and first premolar. So, when you attach the brackets, you have to always consider the vertical height, and the most common error in particular is that the lower premolar is attached to the occlusal surface too much, and the occlusal here is difficult. For the premolar, it is recommended to apply a little deeper than you think. At this time, it is necessary to compare the lower second premolar extraction case with the lower first premolar extraction case. The lower first premolar was extracted. In this case, what would happen if the extraction space was closed? The lower second premolar is moved slightly anteriorly. On the other hand, how should the lower second premolar extraction case be moved? In this way, the lower premolar itself is moved backwards a lot. Compared to the first premolar extraction, in the second premolar extraction, if the bracket is attached at a similar position, there is a high possibility that the tooth axis will be misaligned. In that case, when the extraction space is closed, the area adjacent to the extraction apice should be attached to the gingival side more and more. It should be attached a little deeper. So you must remember that it has to be attached like this. In the lower second premolar cases, brackets are attached when the POP is steep and there is a deep curve of SPE and the lower first premolar mesially inclined. In this case, if the space is closed, the tooth axis would not be parallel and there would be some divergency. So how do you attach it? Attach the adjacent part slightly deeper so that the roots of the first molar and the first premolar can become parallel after closing the extraction space. You must remember this pattern of tooth movement. Let's look at this patient. The first premolar is mesially inclined. I had attached the inclined tooth itself, but it would have been better to attach it like this. So the FACC line goes through like this, and brackets are going to be attached orthogonally there. Since the extraction space itself should be closed, the part adjacent to the extraction space, mesial from the first premolar, will be placed to the gingival side with 5 degrees of angulation. Attaching it like this will allow you to solve the problem that the tooth axis has the slight gap. You need to pay special attention to the lower premolar extraction cases. Brackets should be attached at 4.5 millimeters because the vertical height of the canine is 5 millimeters, and then it should be positioned the distal side a little towards the gingival side. This is the lower first premolar extraction case. When the lower first premolar is extracted, the teeth may be inclined forward in the middle of closing the extraction space and inclined lingually. So there is a high possibility that the mandibular teeth and the bracket in the mandible come into contact with each other. When the bracket touches like this, the lower teeth are more lingually inclined. What you should remember is to use a single buccal tube first in the lower first molar. I also used two convertible brackets at first. It didn't touch at first, but as the teeth move, the food and the teeth in the convertible bracket don't touch. But the food and the bracket come into contact, so the inclination can change. Especially in mio-orthodontics, the molar should be moved forward. In order to be moved forward, the lower molar must be upright. It must be upright so that it can easily be moved forward, and the anterior overbite does not worsen. Which one is better to make the lower move forward? Kim's bracket or the SWA bracket? I recommend the Kim's bracket. In other words, the SWA bracket is applied crown lingual torque. Crown would be inclined lingually, then the root would touch the cortical bone. In this way, the lower molar is not moved forward, but there is a greater possibility of inclining lingually. When attaching the bracket to the lower first molar, use a single buccal tube first. Again, -5 degrees of angulation is given. Door degree of torque is recommended. 5 degrees and 0 degree is also recommended to the lower second molar. For the lower molar, the appliances are not attached to the lower second molar in the initial treatment. The single buccal tube is attached to the lower first, and the height is 3.5 millimeters. In this point, the extraction space is closed, and the bracket would be attached to the lower second molar at the vertical height of the lower first molar. So, in the upper first premolar and the lower second premolar extraction cases, you should choose the bracket first. The SWA bracket is used for the upper 4 incisors. Standard brackets are used for the rest of teeth. In Mio, Kim's bracket is mainly used. You can use a convertible bracket for the upper first molar, and use a single buccal tube for the lower first molar first, and then close the extraction space and then change it to the wide bracket. In U44, L55 extraction cases, when attaching bracket to the upper lateral incisors, the distal should be placed to the gingival side, which mesial is placed to incisors a little, according to the tooth axis. In the case of the lower, it is necessary to close the extraction space. So the adjacent area to be closed should be located more towards the gingival side. If you attach these two brackets more carefully, the treatment process would be simplified. This will facilitate treatment. It would be a good idea to practice drawing lines if possible by using the bracket positioning sheet like this. In review, SWA brackets are used to the maxillary 4 central and lateral incisors. The vertical height of the upper central incisor is 5.0 millimeters, the lateral incisor is 4.5 millimeters, and slight angulation should be given for the upper lateral incisors. The upper canine is 5, the upper second premolar is 4.5 millimeters, and the upper first molar is 3.5 millimeters. In this case, a convertible bracket is used. The brackets are attached to the lower teeth number 1, 2, 4, and 6 first. The height of the lower incisors are 4.5 millimeters, of the lower first premolar is 4.5 millimeters, and of the lower first molar is 3.5 millimeters, and a single buccal tube is used to the lower first molar. And in order to close the extraction space for the lower first premolar and first molar, in this way, for the first premolar, the distal side should be positioned more on the gingival side. And for the first molar, the mesial side should be positioned further toward the gingival side. Thank you for watching.